Does your work make you happy?
Definitely, yes. Happiness is the only thing which makes me tick for today and for next coming 20 years.
Do you think you'll get to that point where you feel like I've stopped learning?
Before every surgery, I do prep myself. I do go back to my books. I go back to my notes, and I will spend 2 hours at night before the day of the surgery. I just don't want to affect my patient's outcome, but I have mistreated that trust because I have gone and said to myself that I know everything. So the day that happens is the day I will say to myself that I'm done. I can pick like 5 different structures from 5 different individuals. I can pick up the most beautiful looking nose, or most beautiful looking eyes, or most beautiful looking pairs of lips, or the sharpest jawline, and I can pick all of them and assemble them in one picture. I don't feel that face is going to be looking natural. It will not look nice at all.
How AI is potentially worsening that?
Yes, it is creating unrealistic expectations, self-expectations. There are going to be these AI prompts. You are going to spend more time on your phone, and that is going to make you feel more and more insecure, bad about your own self, and wanting to do something more and more and more.
I want to talk about the beauty industry because I feel that sometimes it exploits people's insecurities. Welcome back to the House of Yoga podcast presented by Yama Yoga. This is a podcast for the ambitious to feel their calmest. My name is Gabi Kanani. I'm your host, founder, and I'm an international trauma-informed yoga teacher. My work as a yoga teacher and for creating this podcast is to help you feel better. Today, I'm joined by a guest who is helping other people feel the same, but just through a different lens. I'm joined by one of Mumbai's biggest facial plastic surgeons. He is also the founder of ACSC Clinic here in Bandra. Please give a warm welcome to Dr. Yash Mehta.
Thank you very much for your kind introduction.
Thank you so much for being here. It's a pleasure to have you, and I'm really excited for today's discussion.
Yes, same here.
So in today's discussion, what you can expect is topics such as, is self-enhancement a practice of self-love? How is the beauty industry exploiting insecurities, and how are they embracing them? We're also going to be talking about the link between yoga and beauty, particularly facial plastic surgery, as there are many, many different links between the breath and how this can impact the body and our facial structures. I'm also curious to ask Dr. Yash if fixing something on the surface is actually helping his clients and patients fix something deep within, and what we can do to support this in both ways. So that's a little bit about today's discussion. And as you know, in every episode, we enter with a meditation to ground us. And honestly, today I need it as well. I'm a bit nervous. So let's just start this meditation together to ground ourselves. When you're ready, you can come to a comfortable seated position, sit upright and feel the base of your body rooting down into the ground. Let's keep your hands on your knees, palms facing upwards for receiving or down for grounding. If you feel comfortable and you're in a safe space, please close your eyes. We'll roll the shoulders back away from the ears and tuck the chin in slightly. Feel the crown of the head being gently pulled up. And I invite you to observe your breath. Simply observe each inhale and each exhale. Feel how the air around you enters your body Just observe, is it through the left or the right nostril? Can you feel the air coming down into your body? Feeling your belly push out as you're inhaling. And as you're exhaling, the belly comes in. And the air comes out of the nose a little bit warmer than the air that we breathed in. And let's take 3 calming breaths together. Inhaling as much as you can through your nose. Fill up the body, fill up the lungs. Feel the belly come out. And exhale, slowly release. Feel the belly come in, the lungs empty, and the body relax. And deep breath in, fill up your body. Exhale, release, take a big sigh. One more time, deep breath in, fill up your body. And a big, slow release. Just feel the body settle down as your breathing returns to normal without control. Let's bring the palms together in front of your heart in Namaskar. And let's set an intention for today's podcast. To listen and receive. To listen and receive. To listen and receive. You can slowly rub your hands together. And gently press your hands over your face, bowing down to your palms. Bow down to this moment, to this practice, this slow moment that you've made for yourself. Thank you so much for being here today and meditating together. Thank you. How are you feeling today?
Good.
Yeah? I want to dive straight into the episode, and it's with a big question. Does your work make you happy?
Definitely, yes. The work, what I do as a facial plastic surgeon, just does not give me gratification in my work, what I have been able to do for the other person or my patients. But it also gives me a fulfillment of my work, what I have educated myself for. How am I working around with it? And that's where it started I was an ENT surgeon, and then I had keen interest in rhinoplasty. That's like reshaping the nose. And that's where I wanted to embark my journey as soon as I became my last year residency. And that was my fascination, and that was where I was intrigued. So that's where I realized that let me start my journey in this world with facial plastics and making rhinoplasty as my center.
Yeah.
And that's where I started growing in my work. And the more and more cases I did, more and more surgeries I did, more and more joy I started feeling. And if I don't find joy in working or doing my surgeries, I would be the most miserable human being possible, because I would not be happy to just work.
Just for work.
Yeah, I would not be happy. I mean, I don't feel the satisfaction what I'm able to do. I would not be happy at all. So for me, working as a facial plastic surgery surgeon or in this field is exactly, happiness is the only thing which makes me tick for today and for next coming 20 years.
Wow.
So that's the only reason why I feel happy. I feel pressured also with my skills, what the results have to be delivered. So I have to constantly upgrade, constantly learn, constantly understand how each human facial features are going to be tweaked, how they are, and what are my basic principles which I don't have to deviate from. So it's a very, very happy, but I would say a very self-humbling process also while I'm practicing in this field.
Yeah. Wow. That's such an amazing position to be in, that you feel that this is something you want to do again and again and again, because I don't think many people can say that they love their work so much that they see that for themselves for, the next 20 years. So
yeah, so but see, basically when you start getting into medicine, right, from the day one, I'm a third generation doctor. So from day one when I entered medicine, which I knew that this is the only thing which I am able to do or I will be able to practice. And if I don't like something which I'm practicing, then my output or my outcomes becomes very, very bad.
Yeah.
And I didn't want that to happen. So I had to find myself in the field where I was graduating in as an ENT surgeon to find my passion or my purpose, or to feel happy that, if I am doing a rhinoplasty or I'm doing a facelift surgery, I am going to be happy.
Yeah.
And my results are the ones which makes me happy.
Yeah.
And at the same point of time, I'm able to give my patients what they were looking out for and satisfying their requirements also gives me a great joy. And that's the only thing in medicine. If I want to look at it, you have to be married to it and you have to love it. And it's a long haul. It's not a sprint.
Yeah.
It's like a unending marathon, which every day you get up, you repeat the same thing differently, learn from your mistakes, learn from your success. So that is a carry forward process. And the day I stop learning, or I feel like I know everything in my life,
You're not alive.
is the day I will shut my practice down the next day. That means I'm done.
Do you think you'll get to that point where you feel like I've stopped learning?
That's how you have to, as a surgeon, have to start looking out at that, how complicit you become. Right? As I'm growing older, I'm practicing since last 10 years over here in Bombay. So I have to keep on asking myself that how interested I am or how intrigued I am with this case.
Yeah.
Or does it make me go back and open my textbooks again?
Yeah.
And the answer is that yes, before every surgery, I do prep myself.
Yeah.
I do go back to my books, I go back to my notes, and I will spend 2 hours at night before the day of the surgery. And the day I stop doing that, I have told myself that. That means I don't want to learn.
Yeah.
I feel that I know everything.
Yeah.
And the day that happens to me, my results or my patients who have trusted me will start getting affected. So I just don't want to affect my patient's outcome, but I have mistreated their trust.
Yeah.
Because I have gone and said to myself that I know everything.
Yeah.
So the day that happens is the day I will say to myself that I'm done.
Yeah.
That I cannot grow anymore in this field, or that's a full stop for me.
Yeah.
And practicing as a surgeon will become a full stop.
Yeah.
That I have to be intrigued. I have to go back to the basics. I can't take anything for granted. And that's where every surgery I do, every procedures I do, my finesse is the most important parameter, which I judge myself. I would be my own harshest critic ever possible.
Yeah.
Even if my patients are happy, I will go back and I will go back to the drawing board.
How could you do it better?
See it. How can I do it much better? Or how can I even improve the recovery process?
Yeah. Got it.
Even if it is for like 5 days, I have improved the recovery process, or I have cut down from like a month of bruising has come down. How do I do it? What technology I have to use? How my hands have to behave, or what kind of dissections I'm doing. So that's a constant learning process, which I am going to be putting myself down through.
Super interesting. I have to say there's a link there between my profession and yours. Obviously, I'm a trauma-informed teacher, but beyond that, there's so many asanas that I'm still learning about. There's so many of us are still learning about, not only about that, but the anatomy. We have to keep studying, keep attending trainings, keep doing our sadhana ourselves and bettering our practice, right? Not to better it, but to understand ourselves deeper, so that as a teacher, I can also serve better and I can meet many people's needs and really fine tune what I give to them. So I see a link there. Is there anything else you do? Because I was curious when you said about how could my hands do better. Is there something you do to train your hands or something else?
So definitely, right, when we look it into our practice, like when I started my career as a surgical resident, I was 28 years old. Now I'm 42 years old. So aging also catches up, and there are certain things where I want my hands to become steady. I want my hands to not be shaky. I want the precision to be there. I want to stand in a surgery for like 4 hours. So I need to do weight training. That is number one.
Okay.
I have to make sure my back posture is aligned. I might be in the most awkwardest or the most uncomfortable positions in my theaters, surgical theaters sometimes, but I need to fix that and I need to do that. So basically what I do personally is I'd like to do is called as neuro rehabilitation processes, where it's two hands doing two simultaneous tasks.
Okay.
So it can be as simple as rolling a tennis ball in both your palms, one palm going forward, one palm coming backwards.
Right.
Something like, or creating a S kind of a process, another one O process with a tennis ball. You keep on trying to do that. Right?
At the same time.
At the same time. So one left hand says you have to draw a circle. The right hand says that you draw an S. But it has to become at the same time. So that's what we want to keep on achieving, right? That is one. Second is that when I do cadaver courses also to keep up my anatomy intact, that is number one. Number two, I still keep on doing my suturing courses just to make sure that every suture of mine, every knot of mine is gone to a correct depth of the skin. It's just not taken for granted. That I have been suturing from last 10, 15 years, my every suture is going to be correct. No. So that pressure, do I have to give the pressure on my shoulder, on my elbow, or my wrist has to move while I'm taking a bite of my suture? All those things starts working in. So basically I start doing sitting positions, cross-legged, and without any back support. And I try to sit as long as I can, and making sure my back is straight. I can hunch a little, but making sure that every day I start working out. I started doing that every day, 15 minutes. I would like to sit without any back support, straight back without any hunch. Every day, 15. Over a period of last 3 to 5 years, I have started sitting for 35 minutes in one position, without moving, without my back hunching, or even without me wobbling back and forward. So those are the things which also helps me in aligning, and that is a very, very similar process is what you expertise in, and you might be able to do it much farther better.
I don't know about that.
To sit and to do the asanas and sitting. So that also gives me another way of looking into it as being in present, at my present focus while I'm doing my surgery.
You really need to be present with that, right?
So that is where yoga also has helped us in, especially me, that to be in present, to be focused and try to shut down all the other noises which are around for that period of time. So helps me in that way. Yoga helps me. Meditation helps me in that way, where I can say, okay, now for next 3 hours, nothing.
Yeah.
Whatever has gone wrong around me, whatever right has gone around me, it's not going to affect me for next 3 hours. I will handle it after 3 hours.
Yeah. So you practice small amounts of detachment in these moments.
Yeah, absolute detachment is there, but the present, I try to practice being in present.
Yeah.
That is what I like to practice while
Yeah.
I'm doing my surgeries.
Yeah.
To be exactly focused in the present.
Yeah.
And not allowing my mind to go out or go in some other space and come back.
Yeah.
And that's, as a surgeon, has helped me. And yoga definitely, meditation definitely has even given me another edge, that I can extend these things. I don't get fatigued for that 4 or 5 hours, and I'm right there. And for me, precision and concentration are two things which are not negotiable.
It's amazing to hear what you do behind the scenes, because I feel that a lot of not only your patients, but anyone else who's just sees a doctor of any kind from the outside, I feel like it's very normal for us to just narrow down our perception of someone into this one thing that they do, right? We don't see that they are doing these other things, or that they are other roles other than that. And hearing what else you do to, supplement yourself as a surgeon, a facial surgeon, is really amazing. I never expected you to tell me these answers, and it's really great to hear what a help that yoga and meditation is to you. So.
Yeah, definitely. And it is just, it makes it very, very clear. It is just one of the, I would say, a stepping stone or a fundamental correction which you need to incorporate for me, because I want to practice for another 30 years.
Yeah, that's amazing.
I want to do these things. So that is one of the core things which brings you back centered. And of course, there are going to be other numerable advantages to this, which comes, but consistency, practicing it on daily basis is the keystone. It can be for 10 minutes, 15 minutes, 20 minutes, 30 minutes.
As long as you're showing up and practicing.
I need to do it.
Yeah.
And then you start getting into the process where sometimes I don't find time. I'm tired, but I don't stop. I just cut down the time from 45 minutes to 10 minutes, but I will still practice.
Yeah.
But that's what has built up. So that's a slow progress, which I also enjoy myself looking at it.
It's great. And I think a lot of my clients get surprised when I say, well, just do 5 minutes, just do 10 minutes. They're like, what? You only do this amount of time? And I say, yeah, because it needs to fit into my day. And if I'm going for an hour all the time, it's not realistically going to happen every single day. So how do I implement it so that, like you said, it builds that consistency? It becomes just as much as a part of your life as brushing your teeth does, because we need to take care of our energetic hygiene, right? Not just our teeth.
That's exactly the point, right? And I definitely tell my patients that, okay, I've done a surgery. Now what? How is your recovery going to be?
Yeah, I was going to ask you about that. You mentioned before that there's a specific aftercare that you give to each client of yours, and something you mentioned was yoga. I wanted to ask, how does that, and how does nutrition, all these different things, help to recover someone?
So basically, see, when we are working in my field, the problem is not the surgery, but it's the post-care or the downtime. Oh, am I going to have bruising? Am I going to have swelling? How many days I'm not going to go out for? Or how many days the sutures are going to be there? How is this recovery going to come out? Is other people going to judge me that I have done a procedure or not done a procedure? And, it's going to be 1.5 months or 1 month of swelling or bruising around. I don't want to do the surgery. So then now I have to go back and start thinking, right, that, okay, if I was in their place, right, even I didn't want to be moving around with swelling and bruising for like a next 1 month or 1.5 months around. Like, what do I do? And how do we shorten those periods? So that's where we started understanding about the diet, which started playing a very, very important role. And the diet was not just about not eating anti-inflammatory food or vegetables or the diet plan, but it was much more customized to your each and every one's individual body, which was about gut microbiome. So what can I eat which will reduce my inflammation, and how long will it take? So the moment we started implementing, so there is a protocol in our clinic that every surgical case, we will put them on anti-inflammatory diet based on their gut microbiome post the surgery. So, and we have started seeing fantastic results in the post-recovery period has cut down to 20%. And that's a fantastic number for me.
Yeah.
And then after the 20th, after the diet, what is the next step, or what are their do's they should be following or trying to incorporate into their lives? Is like, because I don't see a patient who has come for me for a facelift surgery or a rhinoplasty surgery is willing to go for another rhinoplasty or another facelift surgery in like next 5 years or 7 years or 10 years of time. They are not going to be undergoing. So what does that happen to me? What does that mean for me? That I have to make sure the face is in a correct form. How do we start doing that? And basically what we want is the breathing is a part of a multi-process, right?
Yeah.
Without breathing, I am no one. I can't be alive. So what is the correct way of breathing? Is mouth breathing correct? Is nasal breathing correct? What are we trying to do?
Yeah.
So why it's getting converted into oxygen in my body, for sure, my air. But now why do I stress on them that, okay, after the surgery, once you recover completely, you need to start practicing. Your mouth has to be not, mouth breathing is not 50% dependent. It should be less than that, absolutely. Unless you are running or you're doing a physical exercise where you are running out of breath.
Yeah.
That's the only time where you can use these as mouth breathing as a tool. But on a day-to-day basis, you cannot have mouth breathing. So how do you do that, right? Is start understanding and practicing breathing exercises, which we take out from the traditional asanas or the yoga literature, where they say, okay, you inhale through your nose and exhale through your mouth.
Yeah.
Or you don't exhale through your mouth, you exhale through your nose also.
Yeah.
And or then you start doing alternatively. So when we start telling them, you do start alternative nasal breathing.
Yeah.
So that is where we start telling them not to press too hard on the other side of the nostril. If I have just made your septum and
Right.
have done a rhinoplasty, so I don't want anything to be moved around. But those oxygenating processes where the hot air goes inside your nose, it clears your sinuses out, it comes out, and then it goes back to your lungs. Right? That is the whole process where your sinuses are filled with our air cavities.
What about Ujjayi, where you're doing... It's creating heat from the throat. Would that be safe to do so?
After the surgery, absolutely, yes. Nasal breathing should be the part. Mouth breathing should not be done.
Okay.
Even if I've done a facelift surgery or a neck lift surgery or a rhinoplasty, or even if I'm not doing any surgeries.
Yeah. You recommend your breathing.
Even if I'm not doing any surgeries, right? How do you recommend that? Nasal breathing will make sure that your lower jaw and your jawline is going to be defined.
If you're not doing nasal breathing and moving and breathing through your mouth, what are the impacts?
The impact is, okay, so what the impact happens is when I open my mouth, I'm opening my mouth, okay, what muscles I'm going to be using. So when I open my mouth, I'm going to be using my mastication muscles.
Yeah.
That is number one.
Yeah.
Number two, I'm using my submental muscles, which are in this area, in the neck, where from the hyoid bone, which we call as a sling bone, right? There are all muscles which are going up in the neck region.
Yeah.
Right? When I start doing that, I am laxing the muscles over here. They're not getting taut. The tension of that muscles are getting lesser and lesser and lesser. That is number one. Number two, when I start opening and closing, okay, the laxity of the muscle and the joint also starts working negatively for me, right? And then I start seeing is the tone of the neck muscles completely gone lost. And those are the things where I start looking into. And I feel that if you are not breathing through your mouth and you're breathing through your nose, there is a tension which is already created with your floor of your mouth, with your tongue, which is always going to be present. When you're breathing through your nose, just see how your tongue behaves in your oral cavity. It will always try to push it towards your lower teeth.
Yeah. Yeah. I can
It's
feel that.
always going to push it. Right? So the moment your floor of your mouth is getting taut, the submental region also starts getting a little taut. And that's where the jawline, that's where the neck muscle also starts behaving correctly. And also there is another way where I go back to my residency days, and when I say a child who has come, who's 7, 8, 10 years old, who is walking into the OPD, and we say that, oh, okay, before they even say the complaints, they have a typical face, which is called as an adenoid face, where the jaw will be a little retruded.
Okay.
They will have a nasal flaring happening, or they will be using accessory neck muscles to breathe.
Right.
Right, because there is an adenoid which is present at the root of the nose, which is inflamed, and they can't breathe through the nose completely. So they will always breathe with their mouth open, or their mouth will be always open, will not be shut. So those are the things when we start looking into it, when we start seeing that, oh, the whole oral cavity development or fusion of the hard palate and the soft palate has completely changed. They become a high arched palate. And those are also a structural changes which starts happening into their adulthood life.
Yeah.
Even their teeth alignment, how much of the teeth, how the bite is going to be, how the bite is not going to be, also starts working against them or for them. So those are all the structural changes which are starting through even in childhood. It's just not in the adulthood where I say it's much better to breathe through your mouth or through your nose. No. It's throughout. It's even if you're as a child, if you can't breathe through your nose, you will see the structural changes happening inside your oral cavity. That is definitely in your teeth alignment, in your mandible. Also, you will start seeing changes. And these are all going to be affecting your facial features as you become an adult, or you get aware of it, or someone tries to start passing comments on your facial structures.
Yeah.
That are the times where you might have even forgotten that you had a condition where it is adenoids, where it was causing nasal blockage and you could not breathe through your nose, but the damage is done, or that has to be corrected. So those are the things where it is very, very scientifically linked through why we need to breathe from our nose.
Yeah.
It's just not about creating the heat. It is about understanding the temperature of the surrounding air. Also, when it comes through your nose, there is a mechanism where the air gets filtered through the vibrissae, that means nasal hair.
Yeah.
And that goes up. It also filters as pollutants, also traps certain sizes of the particle pollutants so that you don't inhale them inside.
Yeah.
So those are all, and then they have to go through the sinuses. The air has to rotate through the sinuses, so they keep on clearing the sinuses.
Yeah.
And then the air goes down to your throat and then to your lungs.
Yeah.
So there is a multi-layered process which is there, and it's as simple as to, I mean, in a layman's term, I would like to tell it, it's like, thermoregulation starts happening. You have an inbuilt system that how much ever hot air you have inhaled through your nose, or how much ever cold air you have inhaled through your nose, there is a thermoregulation happening and then going down to your lungs.
Yeah.
And when you start doing with your mouth breathing, the blast is direct.
Yeah.
And then you start complaining of parched throats, not parched throats, dryness in the throat, all those things starts happening.
Yeah.
So those are the things where I would say nasal breathing and facial structure is non-debatable.
Yeah.
So now if you see the latest trends in last 1, 2, 3, 5 years, whatever it is, due to the Instagram or social media, why people are talking about mouth taping.
Yes.
As an adult, why are they talking about it? What is the reason of doing that? Right? Of course, one way is not to have mouth breathing. Second is also to make sure Your jawline also starts working better. So these are the practices which, if you start doing it, you will see a difference. But it's not an overnight difference.
Of course, nothing else.
You need to practice it.
Yeah.
Then and then you see. So it depends.
Yeah.
You want to do mouth taping, or you want to just make sure that you don't open your mouth and breathe.
Yeah.
But that's where the similarities starts coming into back towards this. And in yoga, always it has been said,
Breathe through your
don't
nose.
breathe through your mouth.
Yeah, yeah.
Try to breathe through your nose.
Yeah.
And it's just not just here. It's about your abdominal muscles also becoming stronger. It's about the diaphragm, which is in between your lungs and abdomen, getting stimulated.
Yeah.
Every time you breathe, every time you exhale.
Yeah.
And that's how the whole body, and that's where I say even sometimes deep breathing exercises or shallow breathing exercises, how does it do? And it also starts working, which we call as the word which is used commonly nowadays as vagus nerve stimulation.
Yeah.
And that's the phrenic nerve, which is a part of vagus through your diaphragm, gets stimulated.
Yeah, yeah.
And that's where you start feeling
That relaxation.
correct.
Yeah.
When you start doing your breathing exercises where you're moving your diaphragm and just not that. So there are like multiple roles nowadays which have come into play, which were taken for granted for I don't know how many years. That you're going to breathe and you're going to move your diaphragm. So those are the things where it comes as a multimodality process.
Yeah.
And
Thank
that's-
you for explaining that, because I think that not only have you shown how, you know, you look after your patients after they go through a surgery, but you've helped me as a yoga teacher, and I'm sure many other people who are curious about breathing and mouth taping, exactly what's going on. And hearing it from a doctor's perspective, it's super, super interesting. So thank you for that explanation. And I think you've also tied in so many links that are there between yoga and anatomy, of course. Because a lot of teachers say this thing about your jaw and your hips are connected. And if you're not breathing correctly, then your jaw is going to be tense. And this elaborates exactly why your jaw might be tense if you're breathing through your mouth. I want to talk about the beauty industry, because I feel that sometimes it exploits people's insecurities. And I want to talk to you about your opinion on that and how AI is potentially worsening that. And something that you mentioned to me on our call when we initially got to know each other is that you focus on a patient-centric approach, which is very similar to my work. Like I told you, I don't really do group classes. It's mainly centered around one person. But I really like that coming from this industry, because I feel like growing up as a brown woman, even though it was in the UK, still surrounded by other brown people and constantly having comments about my skin, the texture, the color, about my hair not being straight and curly looks messy, all these different things that not only like close people were suggesting, but also whenever I'd go to a salon, people would be like, do this, do that, do this. Which after a while, it really gets to you and you don't appreciate hearing it all the time. Even if you do embrace yourself and you do love what you already have. So I find it really nice that you're focused on your patients and you don't have this preachy approach where you're saying, okay, you should do this, you should do that. So yeah, I'd love to talk about why you find that so important from your perspective. And again, what you think about the beauty industry and how it exploits people.
So I'll come back to the second question first.
Yeah.
And then how do I approach my patients? For sure. It's a very high personalized approach. Number one is when I was doing my mentorship in facial plastic surgeries, I was working with few of the established surgeons abroad. And we would have patients coming in for their initial consultations. My mentors would start breaking down each and every feature of theirs without asking them for what reason they have come in for, or what is their concerns, or whatever it is, or even if they have heard their concerns, they would still give them that this has to be corrected, this has to be corrected, this has to be corrected, not just this process or anything. And I started observing them, learning about it. I'm like, okay, this patient had come in for doing a blah procedure, but ended up next week signing up for a completely different procedure. And she came in, she did the surgery, and she walked out, and she also thanked my mentor that, it's so great that you noticed it. I was not even able to notice it, and now I'm so happy because you helped me out with that. Then I started seeing that, okay, that happens. I did finished my mentorship with one of my professors in Beirut, and then I went back to UZ University in Ghent. Over there, a similar approach, a different take was going on, and then that's where I decided that when I came back and I had a discussion with my mentors that, why are we dissecting their faces down? Why should we dissect? It's their face, they have lived with them, they don't have that problem, and we have identified that problem for them.
Yeah.
And now they are coming back to fix it. And what if we had never identified that problem for them?
Yeah.
What would have happened? They would have never fixed it, and we would have fixed what they were looking out for. So they said, no, if we would have not done it, some other surgeon or some other doctor would have definitely done the same thing. So I said, okay, fine. I'm learning the ropes. I'm new in the industry, new in my field.
Yeah.
I have to follow what my mentor says or my surgeon says.
Yeah.
Can't argue. And that was the time where I decided, and that the day I start my own practice, the day I have my own clinics and my own surgical theater, there are going to be strict guidelines. And that is where I don't yet dissect anyone's facial features. That you require blah, or your skin requires this treatment to do this, to do that, to do that. No.
Yeah.
I listen to my patients, what are their concerns.
Yeah.
It can be 5 concerns, it can be 1 concern, absolutely fine. Now, after doing that, listening to their concerns, of course, we take a thorough medical history of their allergies, past procedures, past surgical histories, medical histories, medications they are on, not on. After that is finished, we examine them and we give them an option. Option A, option B, option C. This can be done, this can be done. But at the same point of time, we explain them that if I tweak this area of yours, which you are having a problem with, this is going to indirectly affect some other facial structure also. And that is how we are going to be perceived as. And that is what is going to start happening. So my duty as a surgeon when it comes is not to strip down someone's face or dissect someone's face, rather identify one facial features, what they want to be enhanced, and how it is going to sit coherently with their whole face. That is what my job is. And if I feel that if the procedure they are asking is not going to be sitting well, or it's not going to coherently enhance their face or their natural outcome of the surgery, that is where I will say, you are making a mistake. And this is the mistake which you should definitely avoid.
Yeah.
Because in my experience, if I do this with you, this is where it's going to end up. And that will not sit very well with you. Yes, it is perfectly fine. It is. So I give them an example, or I try to educate them in this process that, I can pick like 5 different structures from 5 different individuals.
Yeah.
I can pick up the most beautiful looking nose, or most beautiful looking eyes, or most beautiful looking pairs of lips, or the sharpest jawline, or the narrowest jawline. And I can pick all of them and assemble them in one picture. I don't think that face is going to be looking cohesive. I don't feel that face is going to be looking natural. It will not look nice at all. But now if I start looking them as an individual part, they will be excellent. But I'm not going to be looking that, just concentrate on my nose.
Yeah.
That's it.
You have
or
to
just
see them.
concentrate
It's a whole
on
thing.
my lips. That's it. That's what I want.
Yeah.
That's never going to work out.
Yeah.
Even if I have done the perfect lips for you, but if your face is not able to carry those lips, the procedure is completely failed.
Yeah.
And as a surgeon, I have misguided you, I have misguided your trust in me. So those are the educative things what we practice at ACSC.
I love that.
The second thing is that we never dissect is because I don't want to enforce, because I might like a certain structure or a certain feature of the face.
You have a bias.
So I have definitely a bias. Everyone has a bias.
Of course.
Right? So I don't want that my own biases starts coming out on my patients. And that's the reason I don't say what you need to do for your face. Because I might have a fantasy in my own head that, I like the eyes should be like this. Or I get more attracted to a person who has eyes or their facial structures are like that. Then I will start to emulate them into your face.
Yeah.
Without having understanding how you want your face to be looked at
As an individual.
as an individual. How do I preserve your identity as an individual? I will then not be able to preserve that at all. It will just become my own fantasy coming out in your face. So in our clinic also, there is a rule. Even if you come for like the most least invasive process, like you come for a Botox or you come for a filler appointment or any of these things, I don't inject on the same day of the consultation.
Yeah. Good.
I
Give them
explain
time.
them what is going to happen, what are the steps, and I tell them, please go back now.
Okay.
Come back after minimum 24 hours. And then I will touch your face.
Yeah.
Then I will do the least invasive process. Because we are playing and I have to respect someone's face.
Yeah.
It cannot be like you sit on that chair. It's
not just a massage or a shampoo.
It's not like that. And I don't want the buyer's guilt, right? I have gone out shopping a lot of times, right? I have gone out and I've bought something in the morning, and by the evening I'm like,
why did I get that?
do I really require it?
Yeah.
Did I overspend? Did I not overspend? What should I do with it? So when we take these processes, these are not like that. Right now, I've injected Botox on your face. I can't remove it out. I have injected fillers on your face. I can remove them out if they are hyaluronic acid. Right? But unnecessarily, I have put you into a trauma situation.
Yeah.
Where I have injected, you are not wanting what you wanted, or you were not ready for what to expect out of it, or I was doing my work was not correct.
Yeah.
Then I have made you go through that 24 hours, 48 hours of trauma.
Yeah.
And then you have to come back to me or you go to someone else. That's absolutely okay. But to remove it.
Yeah.
So I have put you through multiple layers of trauma, psychological trauma, which is unaccountable for.
Yeah.
For what?
Yeah. And they lose their authority.
Right.
Their identity, like you said.
And then they don't know. When I was growing up, I had a brand which used to flash up every day on the TV ad, which used to be like a Fair and Lovely or something or the other.
Yeah.
And the obsession about having a fair skin is there, still there, but not as strong as it was when I was growing up. We are getting more aware of it. We are more accepting that fair is not the
only
ultimate benchmark. So these are the things which we are changing slowly.
Yeah.
But we are not yet fully changed.
Yeah. It's very ingrained into society here.
It's very, very ingrained. That, the fairness. I want, we see any of these places, D-tan, what is the meaning of D-tan? I really don't understand. You had tanned. Yes, your pigment is changed. Yes, because of the UV lights, the melanocytes have absorbed that light.
It's very intrusive as well. I've had, sorry to interrupt you, but I've been to get a pedicure, and I see them applying a mask on my legs, and I'm like, oh, that feels nice. And I'm like, oh, what is this? And they're like, D-tan. And I'm like, oh, but I didn't ask you to apply this. I thought I was just getting my toenails done, you know? I didn't mind a mask, but then finding out it's D-tan, again, that authority, that identity is taken away from me because I actually like the color of my skin.
Right? So I'm asking you, what is the meaning of D-tan? Like, why do I still practice or promote D-tanning therapies? Or I don't understand that. And so these are the things which we stay away from at our clinic. There are no it's not about brightening. I mean, there are brightening services. I mean, like, I don't understand what is a brightening service. And really definitely AI, which is coming in, yes, it is creating unrealistic expectations, self-expectations, because you change that filter. Or
then you see yourself normally and you're like,
and then you want to put it into like a AI and tell them, okay, I want a little sharper jaw, or I want a little wheatish skin or a fairer skin, or my hair has to be changed. And that does it, right? And it gives you back that picture and you are like, oh, I look so good. Or that gratification starts happening, and then you start losing in that gratification, and then your identity is going to go away, and then you come back to a surgeon or a place where you can say, oh, I did this, so my jawbone was, or a cheekbone, I wanted a little higher, little slanter, little here, so I could look like this. So this is what the benchmark has become. So those are the things where it is much more of a dangerous way where the future is going in. Because there are going to be these AI prompts. You are going to spend more time on your phone, and that is going to make you feel more and more
insecure,
bad about your own self, and wanting to do something more and more and more. And that's where that line you have to start drawing, right? Where you take on the patient and where you don't take on those patients, and where you tell them that, sorry,
this is not real.
This is not what we should be doing. This is not what we need to be doing. Even if, because these are like constant feeding, subconscious level feeding, like, constant peck, I'm doing. That will drive you to what I want you to do after 5 months or 6 months or 1 year or 3 years. So that is where we need to understand how. I mean, the AI is not going to be stoppable by anyone, right? But I mean, I cannot stop it. I cannot do anything with that. But yes, as a surgeon, as a medical fraternity, when patients come with me with such request, even if it is going to be a minuscule amount, but yes, I can refrain, or I can restrain myself from doing these procedures for these people, or telling them that, look, not worth, not necessary. That's what I can do.
That's great. And I think that you're doing that as a surgeon, and I feel my work as a yoga teacher is to help people have better boundaries with themselves, and therapists will also have this responsibility, trying to not limit their phone use, but maybe change their self-talk and see how they can look at themselves with more compassion, because beauty and media and, image is there, and it has been all the time, but now it's just even more in our face. So I think we work in tandem together, and I think
absolutely. So these are all the stages, right? Where that is what the whole process comes in, right? Where is your limit? How do you center yourself? How do you are comfortable with your own skin? Right? How with your facial structures? And I've seen this happening through, like, unconscious behavioral patterns. Like, it can be your closest ones, or a person who you have met in a cafe for the first time, or you're not met with the person and he's just observing you, and then he's passing comments in his head, or they are discussing about you, or anyone. So these are all the small things, like, that how you had mentioned that, being in UK, curly hair means messy, not straight. These are all very, very relatable fields. Like, parents come and tell us that, oh, my child is getting bullied in the school by the other children. And I mean, for what reason? Because the ear is winging out. It's like a bad ear happening. So they are pulling his ear or making fun of him. And I'm like, okay, like, now what do I do? The child is in the same age group is the same. They are not doing it from an harming intentional purposes. They don't know better.
That's how kids are.
that's how the kids are,
Yeah.
right? I cannot blame the parents for like not parenting correct. And I mean, it's an unending circle.
Yeah.
Right now, what do? You can't scold them, you can't teach them, you can tell them this is not the correct behavior, but then we have to take those patients down. Like we have to do that for the child. Okay, we will do an autoplasty and put your ear a little back so that people will stop teasing you in your school or your friends will stop pulling your ear. Right? But that are all kinds of psychological trauma which has been given, built up.
Yeah.
About the nose. It's too big. It's too small. It's too humpy. It's not correct. It's crooked. So these are all the things which are like from the childhood.
Yeah.
Starts playing. And out of 100, all 100 will not have a problem.
Yeah.
Problem might be having with those unfortunate 15 or 20 who don't have that kind of a courage, or their self-esteem is a little rough, a little weaker.
Yeah.
And those are the ones who are going to get caught on to this process. Right? So that is how the society needs to understand that there is no name calling, there is no shame in that process.
Yeah.
And what are your motivations behind doing this? When I see ads, I see this, now poreless skin, no pores.
So that's so natural.
Korean skin.
Yeah.
How much of a Korean skincare product or the world's best skincare products I'm going to be applying? If you have pores, you are going to have pores.
Yeah. Yeah.
They're not going to go. They can shrink for a period of time, momentary. So these are all the things with glass skin I want.
Yeah.
And poreless skin. And I'm like, okay, so these are all kinds of AI, not AI, social media influenced processes which starts happening.
Yeah.
But I don't know the person who has taken that picture and has
it
they
real?
applied a sheet or anything on their face. I don't know.
Yeah.
But their skin looks fantastic.
Yeah.
But the structures can look very nice. But at the end of the day, I have not seen them. But I'm just going through that image in my head because I saw this thing. Oh, if she had, then why can't I have it?
Yeah.
Or he had it, why can't I have it?
Yeah.
These kind of things are like miscommunicated, misinformed processes which are driving this space.
Yeah.
Which should be a little corrected, understood,
Monitored.
educated about. And that's what we try to do. That pores are going to be there.
Yeah.
You are not going to have a glass skin.
Yeah.
It's not possible.
Good. I'm so glad to hear you just be so honest. And I think it's really important what you've said about the patient-centric thing is to understand that perhaps knowledge-wise, we know our field, but we don't always know what's fully best for a person. They need to have that decision. And yeah, I really, really appreciate this conversation that we've had together. We actually have to wrap up, but I hope that we can have you on again because I think it's been incredibly insightful and I've thoroughly enjoyed listening to you. Thank you, Doctor.
And I would also like to understand more in depth about how Yoga Nidra starts working, how your breathing exercises and what you expect out from the students and how it is transformed.
Yeah.
And that also I would like to understand that for my own purpose and selfish purpose, can I understand, make my recoveries of my patients much better, where the oxygenation starts becoming much better, oxygen flow starts becoming much better, the recovery will change, not change, what are the sustaining results post that. So yeah,
there's absolutely talk and film another episode at a later point with your guys' questions as well. Dr. Yash, as you know, Yama Yoga are supporting this podcast and they've kindly gifted you a set today. So I just wanted to hand it to you.
Thank you. Thank you very much.
You have some joggers in there and a t-shirt and I think they'll suit you very nicely. So I hope you enjoy them. Do let us know.
Yes, sure.
And thank you so much for your time. Thank you for everything that you've shared. And for those of you who've listened today, do you have any questions for Dr. Yash? So you can visit his clinic. It's in Bandra in Mumbai, or you can check out his page on Instagram. I'll have everything linked in the description. But yeah, I'd love you guys to take a moment before you end this episode just to reflect. What have you learned? What are your opinions? Try to listen to that. Maybe take some time to journal or to share this episode with someone that you feel would be really interesting to converse with. And yeah, thank you again, Dr. Yash, for being here.
Thank you very much.
I'll see you guys next week on the House of Yoga for another episode. Thank you and namaste.